Hi, and welcome back to Clinician Spotlight. My name is Tony Maritato, and joining me today is Jennifer Trevino. So Jennifer is an occupational therapist with 18 years of experience. She's also an aging in place specialist. So I am really excited to see how she's helping the residents of the Tampa Bay area down in South Florida stay in their home while they age. Let me see if I can get Jennifer to join us on the call. All right, so Jennifer, thanks so much for joining me today.
Thank you for having me.
Absolutely. So I wanted to start off. I always love to hear how people get started in the profession, like what gets you interested in your profession of occupational therapy. What got you started?
I love occupational therapy, but didn't know anything about it before I
Ah,
first started with it. Actually wanted to go into physical therapy, but decided while I was volunteering that occupational therapy was that much more individualized and customized to their functionality through the activities of daily living and hobbies and whatnot. And so I thought, I think this is a better fit for me.
yeah,
So yeah.
I was like you. I knew nothing about my profession, and I kind of fell into it and totally fell in love. But I secretly think, while I have the PT credential after my name, I think at heart I'm actually an occupational therapist. But
There you
anyway,
go.
so I was looking at your website. Now I'm from the Sarasota area. You are
Nice.
working in the Tampa area.
Yes, yes, I am. I'm just outside of Tampa, actually up more toward the Pasco area, Land
Okay.
O'Lakes, Wesley Chapel area.
And so what does it mean when you say that you're a mobile occupational therapist? How is that different than home health occupational therapy in the traditional sense?
Yes, I think a lot of people don't know we exist. And so, because of changes to Medicare, obviously over the last few years, home health seems to be, much shorter duration for people. And so I feel that there's a gap between what they actually need and what exists in the community. And so they can get occupational therapy at an outpatient level in their home. And with COVID and everything else going on, there's so many people that either A, cannot make it physically, or B, you know, are just not sure if they want to get out there. And so I think mobile occupational therapists and or mobile outpatient therapists meet the need by being able to treat the client in the home at an outpatient level, which is definitely where they need to be.
And what are some of the most common conditions you work with or referrals that you receive?
Lately, I mean, it varies from time to time, especially being in Florida with all the snowbirds, a lot of the orthopedic conditions. But lately, I've been seeing a lot more dementia.
Okay. And are these referrals that are coming from the physician, or these family members that are seeking out services? I know that we've been in a situation where my mom, before she passed away back in 2017, was dealing with some cognitive decline and some dementia. And we really struggled because she wasn't able to get out of the house, but she wasn't homebound. So she didn't qualify for Medicare Part A. Now, you
Exactly.
are a contracted Medicare Part B provider. And
Yes.
so, how would somebody kind of reach out to you if they were looking for services for maybe a parent that isn't able to get out of the house and they're looking to bring services in?
That's where I tend to partner with a lot of community agencies. And I see like the home care companies that already exist and are seeing the clients in the home, but are seeing further concerns, make recommendations for like a home safety assessment or, I'm trying to think of other partners, adult daycares,
What about just somebody
some
like an
other agencies in
aging
the community that have reached out, caregiver support groups and whatnot.
what about just somebody like me, an aging child in the community with a parent who needs help? Would it be something that I could just reach out to my mom's physician to get an order and start, the initial evaluation?
Yes, absolutely. By all
Okay.
means. I've had a few people that have done that. Um,
And if
you know,
somebody was looking to get services started, what kind of a wait time is there from when they first reach out to you with the physician order and Medicare Part B coverage till you can actually get to the home and start working with the client?
very minimal, very minimal. A lot of the people I usually try and pick up and see the same week.
Wow. Okay, that's great, especially in this day and age where it's taking weeks and months to get into brick and mortar outpatient clinics. So
Yes.
if somebody wants to reach out to you, if somebody wants to get a hold of you either for more information or schedule their appointment, what's the best way for them to find you?
For them to find me, honestly, please contact me through my website. It's www.functionalityforlife.com, or you can reach me by email, the same, Jennifer@functionalityforlife.com, or you
Great.
can reach out and give me a call.
Yeah, perfect. What I'll do is I'll put your contact information down in the description of this video. I want to be mindful. I know you're in the car. I know you're probably between sessions. So guys, anybody who's looking for occupational therapy services, it's one of the best kept secrets in healthcare. An occupational therapist who is covered by Medicare Part B, who can come to the patient's home, deliver services, help with everything from cognitive issues to function around the house to even home safety. I think that they're drastically unutilized and provide huge value. So if you're in the Tampa Bay area, reach out to Jennifer. Jennifer, thank you so much for coming on the show.
Thank you so much for the time.